A patellar dislocation or dislocation of the kneecap is a fairly common knee injury, especially among young athletes. In this video, I'll explain how this injury typically occurs, when you need surgery for it, and what the recovery entails. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, I think most people sort of know inherently what it means to dislocate the kneecap. The patella, a kneecap dislocation, is very different than a true knee dislocation, a multi-ligament knee dislocation where you tear 3 of the 4, typically ACL, PCL, MCL, and LCL. That is a very, very bad injury. You occasionally see that in American football. But what we're talking about here is it's a tough injury and sometimes ends up needing surgery, but nothing like that. And that is a dislocation of the kneecap, basically of the patella. And it almost always goes out to the outside of the knee, the lateral side of the knee. And it's typically the same types of mechanisms as cause an ACL. So you run, you plant your foot to change directions, kneecap pops out of place. You land badly from a jump, kneecap pops out of place, some kind of non-contact injury. You can occasionally see it from falling directly on it or getting hit there, but that's certainly not the most common mechanism. Now, a lot of times it will pop right back in. So if it's a subluxation, meaning it's just partially out, it may pop back in on its own. If it's a full dislocation where it's out and it's kind of stuck there, a lot of athletes just spontaneously will just pop it back in, or sometimes just straightening the knee back out will help it pop back into place. But once it stays out of place and those muscles, the quad muscles especially, start to tighten, then it gets a little harder. If you're in a sporting situation and there's a doctor there, a lot of times if you get to it quickly, still you can do it fairly straightforward. But once again, you start to get that guarding from the quad muscles. A lot of times you might need to go to an emergency room where they can give you some sedation, and then the doctor can put it back into place. Now, a lot of patella dislocations can be treated without surgery, especially if it's a first-time dislocation. Usually the only first-time dislocations that end up needing surgery is where you knock a small piece of bone and cartilage either off the patella, the kneecap, or off the front of the femur, and it's floating loose inside the joint. And that loose piece of bone and cartilage can cause issues, can sort of get caught in between the bones with range of motion and do more damage. So a lot of times that needs to be taken out, sometimes if it's big enough, even fixed surgically. But if there isn't one of those, and you typically have an idea that's going on because in that situation, the knee is really, really big and swollen, not just a little swollen, but an MRI can help find that out. But otherwise, it's typically some sort of brace that sort of holds the kneecap in place, but still allows you to have knee range of motion once it's felt to be stable. And even during that process, while that ligament is healing, the medial patellofemoral ligament that tears in a patellar dislocation, you're working on range of motion, working on strength and sport-specific activities with a physical therapist. When it becomes a recurrent problem, that's where very frequently this ends up needing surgery. And not everybody gets to that point, but it can get to that point where it starts to pop out of place multiple times, very frequently. Then that's going to require surgery. Currently, at least, the best treatment of that is what's called an MPFL reconstruction, medial patellofemoral ligament reconstruction, where they basically recreate that ligament that runs here and keeps the kneecap in place. It's a fairly straightforward surgery. It takes about an hour, but it has a fairly long recovery time, anywhere from about 4 to 6 months to get back from sports. People sometimes ask about regenerative treatments. I'm not sure how much regenerative treatments would help that MPFL heal and stabilize the patella on its own, but as something to augment or speed or improve the healing after surgery and the recovery after surgery, maybe things like peptides or some regenerative treatments could speed that process along. It's never really been studied for that purpose. And again, as I've talked about in other videos on this channel, those are largely treatments that are considered experimental. And so it's just something you have to sort of know and decide if it's right for you, and definitely talk to your doctor about. But it's a surgery that does have very good results. Just know that in terms of getting back to sports, it's just a long process and a lot of work on the part of the patient, the athlete. Now, I'd love to hear your experience with your knee injury, so leave those in the comments below. Just understand I can't offer you specific medical advice, but I do try to answer or address that topic in a question in future videos. Make sure to subscribe to my channel, click the bell to be notified when I release a new video and when I start a new live stream like my Ask Dr. Geier live shows. If you have knee, hip, shoulder, or some other joint pain or joint injury, and you want to get significantly better in the next 30 days, but hopefully without cortisone shots or surgery, you can learn more about working with me in the description below. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.